So, Ryan, I'm really excited about this upcoming Reach training. We've talked a lot about Reach, and you presented at our center. Um, the opportunity to have an in-depth training is really exciting, as well as the upcoming book. Can you tell us more about Reach, what to expect?
Yeah, absolutely. Thanks for having me. REACH, or Racial, Ethnic, and Cultural Healing, is a program that I started back in 2020. And it was initially just a program to show up and support young people who are trying to process the impacts of race-based stress in their lives. And at that time in 2020, it was in response to some of the murders of Ahmaud Arbery, Breonna Taylor, and George Floyd. But over the time, I was really thinking to myself, like, what are the guiding principles underlying this space that I'm trying to create for young people? And that's where kind of the reach up or the reach unifying principles kind of came from. It was really my way to kind of efficiently conceptualize kind of what young people are showing up with. And I feel like I needed something to kind of organize myself because not all young people are impacted in the same way. Not all of
Mhm.
them are looking to approach this conversation in the same way. And so I wanted to find a way to customize my conversations for the particular needs and interests that they're coming to me for. So ultimately, that's where what Reach is designed to do is to be flexible and to incorporate evidence-based interventions to support young people in navigating the impacts of race-based stress.
Amazing. Yeah, I mean that's what I've been impressed with. This can be integrated into the evidence-based work we do um, so effectively. It speaks the same language, but in such a tailored way. Um, I guess in terms of the upcoming training, what can people expect, as they um, kind of sign up and get into it?
Yeah, so I mean, this training is designed, one, to help all participants to begin self-examination, right? I think when we want to show up for young people and to have these conversations, I mean, I think we have to be thoughtful about our own stories, our own identity development, and also any biases or preconceived notions that we're bringing to the conversation, because ultimately this approach is about empowering youth and their voices and their values and strengths. And we want to make sure that we're thoughtful about how our stories may either enhance that or maybe get in the way. And so definitely some of that self-examination. And then next is really about using very foundational skills that we tend to um, use within evidence-based interventions like CBT, DBT, and ACT, one of which being the use of thoughts, feelings, and actions. And how do we understand what race-based stress can look like within someone's kind of thoughts and feelings and behavioral patterns. And then from there, it's really trying to kind of understand how to conceptualize the specific impacts that young people may be coming with, and how do I kind of build out an intervention that is both patient-centered, culturally sensitive, and also within your efficacy as a clinician. And that last piece is something I really want to help people walk away with from these trainings with is, not necessarily feeling I need a whole separate course of, training in a graduate program to be able to show up and support young people, but maybe just some fine tuning of the skills that I already know to be able to effectively do so. And so that's what I hope people are able to walk away with from this five-part series.
Amazing. Yeah. And I really think the way you've built this out with Praxis to have enough time to do that is you know, really exciting and a unique opportunity to get the kind of decade long kind of research that you've put into this solidified into a training that people can put to use in their practices. And I would just say, like, from our conversations and the presentations I've seen, this feels very relevant to adults as well. Um, I don't know if you
Absolutely.
agree.
Absolutely. Yeah. In my practice, so I lead a program at the Ross Center
Mm.
that is called the REACH program. And we do also support not just preteens and teenagers and even young adults who are in college, but also folks in their later 20s and 30s, and even some early and mid-year professionals. And so it's this training is really I think, applicable across that age range and can provide some skill sets and conceptual frameworks for being able to, either build a whole treatment around race-based stress for an individual, or to be able to adapt existing treatment plans that maybe are focusing on something else, but to be able to adapt those whenever discussions regarding race-based stress feels really relevant. And so it's kind of can be both that very heavily specific discussion, or one that is kind of more responsive to when it shows up in the treatment across that age range. So if you don't work with kids, but you still want to receive some of this material, I definitely feel like you could walk away with something quite beneficial.
Yeah, I've definitely gotten that feel, and I think this is so valuable to be able to incorporate into the treatments we're doing and be able to really make them accessible, because we know the principles often work
Hmm.
across um, different groups, people with different backgrounds, but being able to tailor them in the way that you're showing people, I think is just a critical piece. So
Yeah.
grateful for that and super excited for the training.
Yes, yes. I think about it, I think about a couple of things. If you're somebody who really wants to kind of fine tune some of your skill sets, maybe you already have worked with people of color and you kind of want to just get a new introduction to something else, then absolutely come in and there'll be opportunities to share some of your expertise as well that I'll try to open it up. But then also, if you're somebody who notices that, like, this is a conversation I want to participate in, but maybe you get a little anxious to start the conversation, or you're like, I'm not sure where to go with this conversation when it comes up. This is also a space for that, right? Sometimes we need some principles and some tools to ground ourselves in whenever we may feel a little uncomfortable approaching things with clients and patients. And so my hope is that you will walk away with those tangible kind of anchors, that can ground you as you're trying to show up and do this work. And so it can be, if you're somebody who's very confident, or somebody who's kind of, maybe the confidence level is not as much as you would like. I think this is a space for anyone in between as well.
Fantastic. Thanks so much for taking a little time to talk this morning.
Yes, thank you for having me. And I look forward to speaking with you all very soon.